Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. We are looking at the Eustachian tube and its causes, obstruction causes. So there are two types of obstruction causes. So first will be the mechanical. So before going to the mechanical, let's look at the functional. So under functional, there are very few points. That is, the functional ET obstruction can be due to the cleft palate. So it may be due to the cleft palate. Next is it can be due to the DS, that is a Down syndrome. And the next one will be due to the neuromuscular disorders. So this is about the functional causes of the ET obstruction. Next is we move on to the mechanical causes. So here in mechanical causes, it is again divided into the extrinsic and the intrinsic. So by extrinsic, it is nothing but the block at the opening. So there is a block in the opening. And what are these? So these may be the adenoid hypertrophy. So adenoid hypertrophy, it can be due to, it is a cause, and then it can be due to the nasopharyngeal tumor, NP tumor. So it may be due to the adenoid hypertrophy, nasopharyngeal tumor. Then it can be due to the DNS, as well as a sinonasal polyps, as well as next it may be due to the sinusitis. So to recap, it is adenoid hypertrophy, nasopharyngeal tumor, DNS, sinonasal polyps, as well as the sinusitis. So this was about the extrinsic type under the mechanical. Next will be the intrinsic. So this intrinsic or the edema. So what are the types here? So it is due to the URTI, upper respiratory tract infection, as well as the allergy. To learn and grow daily like this, please do subscribe.